Good morning, this is Dr. Martin again. Today we're going to get into something a little more meaty. I like to put meat on the bone in a lot of these videos. I know we talk about very esoteric subjects at times, but we're going to try to dive a little bit deeper into practical applications in the field of aesthetics. Now, most of you are seeing a relatively large paradigm shift. And that relatively large paradigm shift, it started in South Florida, in particular Boca Raton. And a few months later, it started on the West Coast in kind of Rodeo Drive and in Beverly Hills. And now I'm hearing about it in Kentucky and New York and Tennessee and Texas. And it's kind of starting at the periphery and then kind of making its way inland. And what we're seeing is the transition from synthetic applications in aesthetic medicine to natural applications in aesthetic medicine. Now, what we're going to do today is we're going to go through a number of the products that Platinum Biologics offers in kind of the smart ways to apply those. And we're going to be dropping literature like I always try to do, so that we kind of have a general understanding for how that's done. I'm not going to yawn on forever here, but we are going to try to make this comprehensive and worth your time to watch. So we're going to be reviewing some of the more pertinent applications in aesthetic medicine. We're going to be talking about scalp restoration. Number 2, we're going to be talking about face. Number 3, we're going to be talking about filler. And number 4, we're going to be talking about lips. And I know everyone's excited about this. Now, part of the reason there is this transition away from complex HA, from biostimulants, is that we're starting to see something called filler face, right? And if all of you haven't heard the term, filler face was actually coined by a plastic surgeon. Most of you now know that if you use a complex hyaluronic acid, that when you put that into the dermal tissues of the face or even subcutaneous, that up to 10 years later, we're finding proliferating hyaluronic acid, proliferating synthetic HA, complex HA, creating more HA. And it's diffusely through the face. It's not just where it was applied, they're finding it diffusely through the face. And so what would happen is, with all of this hyaluronic acid stimulating type 1 collagen, stimulating fibrin, it was changing the tensile resistance of the skin, meaning it was replacing elastin in the skin. It was disrupting that delicate balance in your dermal layer, right? Not the epidermal layer, the dermis, where you've got this lovely balance of type 1 collagen, type 3 collagen, and elastin. And now we were getting this over amplification of type 1 collagen, which was reducing the elasticity of the skin. And so with all of this filler, when plastic surgeons went to do a deep plane facelift and undermine the areas of the under eye, the upper eye, the jowls, and the chin, and then tried to pull that tissue back and then tuck that scar in around the tragus of the ear, now because of the increase in tensile resistance on the skin, there was more tension on those suture lines. That, in combination with the fact that around 30% of the US population is now diabetic or pre-diabetic, and they just don't simply heal that well, increase in tensile resistance on sutures, poorer nutrient flow to the skin, more inflammation due to diabetes or pre-diabetes, and what do you get? You can get necrosis of the flap, you can get necrosis at the suture line, you can get just a hypertrophied scar at the suture line, or worse, dehiscence of the wound and potentially operative site infection. And so doctors that would see this, plastic surgeons that would see this, they just said, we're just not operating. go back to see your esthetician, go back to see your cosmetologist, go back to see your dermatologist who overfilled you, and good luck with that, because I'm not touching it. I don't want the liability. That was nail in the coffin number one. What was nail in the coffin number two? Nail in the coffin number two is vaso-occlusion. All right? And there's probably only one S here. You see it with VASO occlusion and VASSO occlusion. This is very common in the lips. All right? And it's not being talked around because it's a sealed indictment, but there was a very, very large sum of money paid out to a patient who ended up getting filler in the lips, and the patient ended up having necrosis of the lip due to a vaso-occlusive crisis that went unrecognized by, I believe, the esthetician that did the procedure, and she ended up losing her lip tissue, had necrosis of the lip, and had to have multiple plastic surgeries to try to reconstruct her upper lip. That has really put a chill on filler in the lips, because anytime you put a synthetic filler, even a complex HA, that has the potential of occluding a vessel in a region with blood vessels, you can get tissue necrosis. Now, that vaso-occlusive crisis is not limited to the lips. Vaso-occlusive crisis we see very commonly going deep in the cheeks. I don't know why some people go deep under the eyes, but some people do. You can get vaso-occlusive crisis there. You can also get vaso-occlusive crisis when you go deep in the temples to try to restore volume down under the muscle and over the bone. These are all very common areas of vaso-occlusive crisis, all right, with potential tissue necrosis. So let's just talk about three of the more common biologics that are used, that are platinum biologics products, and that we see used very commonly in aesthetics, all right? Let's first start with a product called, well, we're going to talk about three. We're going to talk about NanoJelly. We're going to talk about NanoEX, Nano-E, capital X. We're going to talk about NanoFlow. And then we may also talk about a fourth. Call it NanoAer. Okay? Wharton's jelly, exosome, Wharton's jelly, exosome. We alternate a little bit here. Okay, let's start where we start. Let's dive in, okay? Most of you have seen me lecture on scalp and on face. Very quickly, the protocol that I think works best, having done so much application for scalp and face, is an application wherein we are only using a microneedle pen, microneedle, and we're only microneedling at 0.25 millimeters. Now, I know this sounds crazy. We're only microneedling at 0.25 because almost all of you who have done microneedling out there, well, if you're doing scalp, you're injecting. If you're doing forehead, you're microneedling at 0.5. If you're doing cheeks, you're microneedling at 1. Jowls, you're microneedling at 2 millimeters. Chin and undersurface of the chin, maybe you're using 2.5 millimeters. What's the cardinal problem in all that? The cardinal problem in all of that is that you're using benzocaine, lidocaine, and tetracaine, right? We're using something called BLT. Now, BLT being, again, benzocaine, lidocaine, and tetracaine, when you apply that to the skin, after 30 minutes, that benzocaine, lidocaine, tetracaine can penetrate up to 5 millimeters. Now, Are we microneedling anywhere on the face deeper than 5 millimeters or on the scalp? Absolutely not. So if our lidocaine, tetracaine, and benzocaine are penetrating deep to 5 millimeters, so all the way down, we're getting benzocaine, lidocaine, tetracaine through that entire tissue. And we're only microneedling halfway down. And we're putting a biologic in about here. What's happening to the biologic? Well, there's literature back since 1990 that demonstrates that lidocaine is immediately cytotoxic to stem cells. Not only is it immediately cytotoxic to stem cells, but a biologic like an allogenic allograft or even just PRP. The goal of applying that biologic is to stimulate the body's own collagenous differentiation. There's very good literature that demonstrates that lidocaine shuts off that process of collagenous differentiation for 2 weeks after application. So even after you apply it and it's immediately cytotoxic to stem cells, which means it's going to denature the very biologic you're administering, it will continue to impair the collagenous differentiation you applied the biologic for in the first place for up to 2 weeks after application. That's a nightmare, all right? So how did we get around that whole scenario? Well, number one, we got rid of the BLT. Because all of you who are running an aesthetics practice know that your 1030 doesn't show up at 1030. They show up at 1035. And when they show up at 1035 and they're there for a microneedle or whatever else, they don't have BLT on their face because they're not just driving around with BLT. So what do they have to do? Well, they've got to go put BLT on and sit in the waiting room for 30 minutes. So now you're sitting there with a gap in your schedule for 30 minutes. And what happens when it's 11:05 and that patient's ready to be microneedled? Your 11 o'clock walks in at the same time, and now you're double booked, right? And now you're backed up for the entire rest of the day. And because you're booking patients every 30 minutes, the only way you run an efficient practice is either by planning on this happening and leaving gaps in your schedule, which means you're losing money, or hoping that somebody cancels on another esthetician's schedule so that you can slot that patient in there. And all that does is piss off the esthetician who just lost a patient to her colleague and lost revenue to her colleague because you built in a scenario that was built to fail. An aesthetics practice reliant on BLT is automatically built to fail because your patients don't travel with BLT. And they come usually 3 to 5 minutes late for their appointment because there's a line at Starbucks or wherever they're getting coffee, right? Or there's traffic, and they still have to put on BLT. So for the love of God, make your clinic run more efficiently and just microneedle at 0.25. We've done the observational studies. The observational studies are if you take NanoEX and you microneedle at 0.25 by taking NanoEX plus a hyaluronic acid and apply it to the skin in microneedle, just at 0.25, you get a better result than microneedling deep and a quicker result. Most patients that are getting microneedled, they have something planned. They have an event planned. They want to go somewhere. They want to do something. And they're coming in on a Thursday planning on being at that event Friday or Saturday. Well, if you microneedle deep, forehead, cheeks, jowls, chin, they can't wear makeup for 2 or 3 days. They may not want to be out for 2 or 3 days because they're super red. If you did PRP, a vampire facial, that face is swollen up and puffy for 2 or 3 days. They're going nowhere. If you're using an umbilical cord-derived exosome, it's going to naturally down-regulate inflammation, has collagenous growth factors type 1 and type 3, has growth differentiating factor 11, which stimulates tropoelastin, which is the precursor for elastogenesis, which also stimulates dermal fibroblast proliferation, and you're only microneedling at 0.25, they get a glow up 24 hours later. They can wear makeup 24 to 36 hours later. They can get that microneedle procedure Wednesday, Thursday, and be at that event, no problem, looking fabulous Friday, Saturday, Sunday. And they're not going to mess your schedule up by waiting 30 minutes for that BLT to actually penetrate the skin and eventually denature the biologic you're applying anyway. Now let's get to the practical application of how we do this. We want to use alcohol-free witch hazel. We're going to prep the face with alcohol-free witch hazel. We're going to let the skin dry. NanoEX is a lyophilized exosome. We're going to reconstitute that with hyaluronic acid. All right? Use the hyaluronic acid of your choice. Platinum has a hyaluronic acid. Typically, I like about 4 cc's of hyaluronic acid plus a cc of normal saline. You can draw up your hyaluronic acid and your 1 cc of saline into a 5 cc syringe. You can then push that into the vial of NanoEX, and just like a peptide, bring NanoEX into solution. You're then applying NanoEX regionally, and I'll tell you why. If I apply NanoEX to the forehead, to the upper cheeks, lower cheeks, jowls, and chin, and I start gliding and I start microneedling the forehead up here, by the time I get down here, the whole face is dry. Because every patient, I don't care who they are, they wash their face before they see their esthetician that morning. So their face is naturally dry. And so when you put a combination of hyaluronic acid, normal saline, and an exosome product, and you apply it to the whole face, you may start gliding up here, but by the time you get down here or even over here, the skin's dry. And now you have to go grab another vial of NanoEX, more HA and more saline, and reapply, which just destroyed your net profit per procedure. So my advice, apply regionally, microneedle regionally. And we're literally just applying the biologic, a couple drops, using a gloved finger, smear it in just like a serum, and then microneedle by gliding that region. All right? Apply to this region here, microneedle it in. Apply to the upper cheek, drop, 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 smooth the skin, glide. Drop, 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 smooth the skin, glide. All right? Now, we don't do anything different for scalp. I might use a little bit more mature combination of products, meaning that if I'm doing scalp, right, I'm not using NanoEX plus HA, I'm using NanoEX plus a GHK copper, which has hyaluronic acid in it, right, which is 4 cc's, right? And then I'll use either normal saline or I'll use NanoJelly because I like my tiers, meaning that my top tier protocol for scalp is to combine NanoEX with 4 cc's of GHK copper and 3 cc's of NanoJelly. That will give me a total volume of 7 cc's, plenty to cover an entire scalp. I'm only microneedling at 0.25. How do I do this practically to the hairline? Say I have a patient with very long hair. This is really very easy, okay? We're going to part the hair. Once you've parted the hair, because we've prepped the scalp with alcohol-free witch hazel, no different than we do the face. Once we've parted the hair, right, I see bare scalp at the part. I will take my combination of NanoEX, GHK copper, and NanoJelly. I will drop a bead line from the front to the back of the scalp. I will smooth it with my finger. After I've smoothed it with my finger, I will stamp along that entire area, microneedling the region. I will microneedle just left. I will microneedle just right. Then, very simply, I take a wide tooth comb, I comb the hair back, and then I create another part just left of that prior area. And I might drop my bead line of biologic, and I microneedle along that right along the scalp. And then after I've done that, I part the hair again. And I drop a bead line of biologic, microneedle, do it again. Drop a bead line of biologic, microneedle. Once I've taken care of one side of the scalp, I do the other side. Drop a bead line on the part, microneedle. Again, part the hair straight back, drop a bead line of biologic on the scalp, smooth it with my finger, and then microneedle. And then so forth and so forth. This is how you microneedle the scalp. Much easier in a man with very short hair, but even if it's a woman with floor-length hair, you can still part her hair, and you'll be able to see scalp as you part. Apply the biologic along the scalp, smooth it with your finger, and microneedle. And again, we're only microneedling at 0.25. The microneedle pen we're using, this is important, we're using a Dr. Pen M8. Why are we using a Dr. Pen M8 with a 36 pin tip? These are about $3 to $4. How much is a skin pen? A skin pen is $5,000 to $7,000. The refill cartridges are $86. I don't care how much you're charging for scalp restoration. You can't afford $86 in supplies on top of your biologics for every case and hope to make any money. A Dr. Pen M8 is $150 on the drpen.com website. The refill cartridges are $3 to $4 on Dr. Pen's website. Every now and then you can find them on Shein for like $2 or $3. All right. I prefer the 36 pin tip because I can use it everywhere. They come 16, 36, and nano. I don't buy the 16, I don't buy the nano. I use the 36 and I use it for everything. Let's move on. NanoJelly. NanoJelly is a Wharton's jelly. It's cryopreserved. All right. So NanoJelly is cryo. We're going to put a C here. NanoFlow is cryo. NanoEX is lyophilized. NanoAer is lyophilized. This cryopreserved product has to be stored at -20 degrees Celsius in a cryo freezer, ideally. In a cryo freezer, it'll be good for at least 8 months. All right. NanoJelly is 3 cc's of product. This is a perfect product to replace your PRP for your vampire facial. Most PRP kits are between $250 and $400 a PRP kit. You have to draw blood, you have to pay for a nurse. NanoJelly is 3 cc's. All right. If you need more volume, add HA. It's inexpensive. If you need more volume, add normal saline. It's inexpensive. Wash the face with witch hazel, alcohol-free witch hazel. Apply regionally, microneedle. Apply regionally, microneedle. Apply regionally, smooth it like a serum, microneedle. Super, super easy to use NanoJelly as a replacement for a vampire facial. You could use NanoEX or NanoJelly. All right. How do I differentiate between the two? Sunspots, inflamed skin, damaged skin, acne, I tend to use NanoEX because exosomes downregulate inflammation, number one, and exosomes have LL37AMP, an antimicrobial protein. That antimicrobial protein is wonderful for acne because it's a bacterial process anyway. So exosomes is what I always use if I'm microneedling for acne. if I'm looking at crepey skin, if I'm looking at volume loss, if I'm looking at, light wrinkles or even deep wrinkles, and I'm doing microneedling for the face, I prefer NanoJelly. I want those robust collagenous growth factors, okay? Can you use NanoJelly anywhere else? You can, but understand that NanoJelly has tissue in it. Because it has tissue in it, you need to stay superficial. Where you can use NanoJelly superficially by aesthetics cannula is under eyes, so you can use it for under eyes. What I simply do, and there's a video of this in the Facebook group, is I numb the skin right about here. I drive the cannula perpendicular to the eye, right up close to the tear duct, but not in it. And then I drop 1.5 cc's right, do the same thing, drop 1.5 cc's left. You can also do nasolabial folds. I'm going to be superficial again. I'm going to drop a tiny little skin wheel of anesthetic. It's not going to be here where I'm applying my biologic, but here, drive subcutaneous, drop product on the way out. All right? You can apply it those two regions. If you want to apply subcutaneous in the temples, subcutaneous, again, tiny little skin wheel, drive the needle, drop on the way out. Tiny little skin wheel, drive the aesthetics cannula, not the needle, a 25 gauge aesthetics cannula, drop on the way out. All right? Most commonly, you're applying NanoJelly subcutaneous through 25 gauge aesthetics cannula for Ozempic face, for GLP-1 induced volume loss. All right? Under eyes, temples, nasolabial folds. Now, what if I want to go deep, right? What if I want to drive this product deep on the cheeks? I want to drive it down to the bone in the temples, right? If you're going to do that, my strongest recommendation is to use one of two products, all right? Either NanoFlow or NanoAer. I like both depending, again, on the type of cartilage-based defect present, right? If somebody lost weight because of a GLP-1, all right, I will probably use NanoFlow for volume loss because I have muscle loss and fat atrophy, all right? I'll use NanoFlow because I've got more collagen-based growth factors, because this is a tissue-less Wharton's jelly. It's not going to cause an occlusive crisis. So if I want to go deep in the cheeks, if I want to go deep on the bone in the temple, if I want to go deep somewhere else, like deep in the nasolabial folds, all right, I will use NanoFlow. If I have a more inflammatory paradigm, somebody had a viral illness, was sick, somebody had long COVID, was sick, and it's a post-viral, post-inflammatory issue with volume loss, now I'm going to use NanoAer. NanoAer is lyophilized. I'm going to reconstitute this with probably 3 or 4 cc's of saline. And again, I'm going to use usually a cannula and drive it deep, all right? Making sure that I'm aspirating before I inject. Even though it's aqueous, even though you're not going to get a vaso-occlusive crisis, you still don't want to be in a vessel because you're not getting any benefit from the product if it gets whisked away by a blood vessel, all right? NanoFlow is 1 cc or 2 cc's, all right? And again, if I was going to inject this deep, I would probably use an additional either 3 or 2 cc's of saline for a total volume of about 4 cc's. And, 2 cc's deep in the cheek, 2 cc's deep in the other cheek. That's our filler, right? That's our replacement for HA. If we're going deep, tissueless products, NanoFlow, all right, usually for GLP-1 induced volume loss that's fat and muscle. NanoAer for volume loss that's typically more inflammation induced, illness induced, that kind of thing, right? Because you're going to downregulate inflammation with that exosome, but you'll also have collagenous growth factors. Total volume for each, probably 4 cc's, right? NanoFlow being cryopreserved, have to add either 2 or 3 cc's of normal saline, NanoAer being lyophilized, again adding 4 cc's of saline, or 5, whatever you like, and then reconstitute just like you would a peptide. Wrapping up, we're going to talk about lips. I'm going to have 2 wonderful articles here about vaso-occlusive crises in lips. And again, based on our initial discussion, there was a very big lawsuit that happened because of this. Again, I don't know how much the claim was because from my understanding, it's a sealed indictment, but it was over $5 million. All right. What do I like for lips? I like NanoFlow for lips. All right. NanoFlow comes in a 1 cc. 1 cc is about what you would use in lips anyway, right? It's perfectly aqueous. You're not going to get a vaso-occlusive crisis. You can push NanoFlow through anything as small as a 31 gauge needle. All right. We're not using any anesthetic with this. We're just icing the lips. We're not using BLT. We're just icing the lips and then we're injecting. All right. So lips, we're using NanoFlow. Filler, meaning deep, we're going to use NanoAer or NanoFlow. Microneedling, we're using NanoJelly or NanoEX. Scalp, we're using NanoJelly, NanoEX, and usually GHK copper. Certainly, if you have more questions, you are more than welcome to jump on a peer-to-peer call. I'm going to put the peer-to-peer link in the Facebook group along with all the published studies for this application. This was just a quick down and dirty because I'm talking to so many aesthetics practices. I wanted to review the most common biologics, at least the Platinum Biologics has, in how they're more commonly used in the face. Again, I'm Dr. Martin. Have a very blessed day.